Inktober Mental Illnesses and Disorders. Every October, artists all over the world take on the Inktober drawing challenge by doing one ink drawing a day the entire month. Artist, Sean Cross. Avoidant personality disorder is a cluster C personality disorder. Those affected display a pattern of social inhibition, feelings of inadequacy and inferiority, extreme sensitivity to negative evaluation, and avoidance of social interaction despite a strong desire to be close to others. Individuals with the disorder tend to describe themselves as uneasy, anxious, lonely, unwanted and isolated from others. The behavior typically begins by early adulthood, and occurs across a variety of situations. Depression is a common but serious mood disorder. It causes severe symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. Insomnia can be caused by psychiatric and medical conditions, unhealthy sleep habits, specific substances, and/or certain biological factors. Recently, researchers have begun to think about insomnia as a problem of your brain being unable to stop being awake. Depersonalization disorder is a mental disorder in which the person has persistent or recurrent feelings of depersonalization and/or derealization. It is described as a feeling of disconnected or estranged from one's body, thoughts, or emotions. Individuals experiencing depersonalization may feel as if they are an outside observer of their own thoughts or body, and often report feeling a loss of control over their thoughts or actions. In some cases, individuals may be unable to accept their reflection as their own, or they may have out-of-body experiences. Bipolar disorder causes extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts in the other direction, you may feel euphoric and full of energy. Mood shifts may occur a few times a year or as often as several times a week. Bulimia nervosa is a serious, potentially life-threatening eating disorder characterized by a cycle of binging and compensatory behaviors such as self-induced vomiting designed to undo or compensate for the effects of binge eating. Dependent personality disorder is a pervasive fear that leads to clinging behavior and usually manifests itself by early adulthood. It includes the majority of the following symptoms: difficulty in making everyday decisions without an excessive amount of advice and reassurance from others. Alice in Wonderland syndrome is a disorienting neurological condition that affects perception. People experience size distortions such as micropsia, macropsia, pilopsia, or teleopsia. Size distortion may occur of other sensory modalities. It is often associated with migraines, brain tumors. It is due to abnormal amounts of electrical activity causing abnormal blood flow in the parts of the brain that process visual perception and texture. Postpartum depression occurs in women soon after giving birth. It can start any time during baby's first year, but it is most common to start to feel its effects during the first 3 weeks after birth. Symptoms include sadness and hopelessness. The quick change in hormone levels can trigger depression in some women. Counseling and antidepressants are treatment options. Obsessive-compulsive disorder is a common mental health condition in which a person has obsessive thoughts and compulsive behaviors. It affects men, women and children and can develop at any age. Some people develop the condition early, often around puberty, but it typically develops during early adulthood. OCD can be distressing and significantly interfere with your life, but treatment can help you keep it under control. Body integrity identity disorder is a rare, secretive condition in which there is a mismatch between the mental body image and the physical body. Subjects suffering from BID have an intense desire to amputate a major limb or sever the spinal cord in order to become paralyzed. It is a desire for disability like blindness or sterilized. It results from a neurological failing of the brain's inner body mapping function in the right parietal lobe to incorporate the affected limb in its understanding of the body's physical form. Substance use disorder is a condition in which the use of one or more substances leads to a clinically significant impairment or distress. Substance abuse may lead to addiction or substance dependence. SUD refers to the overuse of, or dependence on, a drug leading to effects that are detrimental to the individual's physical and mental health. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. Although schizophrenia is not as common as other mental disorders, the symptoms can be very disabling. Attention deficit disorder affects mostly children but also some adults. It is characterized by symptoms including inattention, hyperactivity and impulsive behavior. These symptoms are associated with learning, behavioral and emotional problems. Dissociative identity disorder, DID, is characterized by at least two distinct and relatively enduring identities or dissociated personality states that alternately show in a person's behavior, accompanied by memory impairment for important information not explained by ordinary forgetfulness. These symptoms are not due to substance abuse, seizures, or other medical conditions. There is considerable comorbidity with other mental disorders. Panic disorder is where there is recurring and regular panic attacks, often for no apparent reason. Panic attacks are sudden periods of intense fear that may include palpitations, sweating, shaking, shortness of breath, numbness, or a feeling that something bad is going to happen. Agoraphobia is an intense fear and anxiety of being in places where it is hard to escape, or where help might not be available. It usually involves fear of crowds, bridges, or of being outside alone. It occurs when a person has had a panic attack and begins to fear situations that might lead to another panic attack. Conduct disorder, CD, is a mental disorder of childhood or adolescence. Shows a repetitive and persistent pattern of behavior in which the basic rights of others or major age-appropriate norms are violated. These behaviors are often referred to as antisocial behaviors. It is often seen as the precursor to antisocial personality disorder, which is not diagnosed until the individual is 18 years old. Trichotillomania is a body-focused repetitive behavior, which involves pulling out one's hair, occurring more frequently in females. Hair pulling may occur in any region of the body, but the most common sites are the scalp, eyebrows, and eyelids. A stressful event such as abuse, family conflict, or death may trigger trichotillomania. Autism spectrum disorder, ASD, is a condition that affects social interaction, communication, interests and behavior. Several complex genetic and environmental factors are involved. The symptoms are present before 3 years of age, but difficult to detect. There is no permanent cure for ASD, but interventions are available to help children and parents. Disinhibited social engagement disorder, DSED, of childhood is an attachment disorder that consists of a pattern of behavior in which a child actively approaches and interacts with unfamiliar adults. Significantly impairs young children's abilities to relate interpersonally to adults and peers, such as sitting on the lap of a stranger or peer, or leaving with the stranger. It is exclusively a childhood disorder and is not diagnosed before the age of 9 months or at the age of 5. Infants and very young children are at risk if they receive inconsistent or insufficient care from a primary caregiver. Narcissistic personality disorder is a mental disorder in which people have an inflated sense of their own importance, a deep need for admiration and a lack of empathy for others. Behind this mask of ultra-confidence lies a fragile self-esteem that is vulnerable to the slightest criticism. Misophonia is a selective sound sensitivity syndrome with a strong dislike for hatred of specific sounds. It starts with a trigger, often an oral sound such as the noise someone makes when they eat, breathe, chew, yawn, or whistle. The disease can put a cramp in social life, avoid restaurants or eat separately from family or roommates. Person may attack one who is making the sound physical or verbally, cry, or run away from the situation. Borderline personality disorder is a serious mental disorder marked by a pattern of ongoing instability in moods, behavior, self-image, and functioning. These experiences often result in impulsive actions and unstable relationships. A person with BPD may experience intense episodes of anger, depression, and anxiety that may last from only a few hours to days. Post-traumatic stress disorder develops in some people who have experienced a shocking, scary, or dangerous event. A condition of persistent mental and emotional stress occurring as a result of injury or severe psychological shock, typically involving disturbance of sleep and constant vivid recall of the experience, without responses to others and to the outside world. Capgras syndrome is the irrational belief that a familiar person or place has been replaced with an exact duplicate, an imposter. It occurs more frequently in females, seen in patients suffering from paranoid schizophrenia, brain injury and dementia. Also in individuals with neurodegenerative disease of older age. It has also been reported as occurring in association with diabetes, hypothyroidism, and migraine attacks. Anorexia nervosa is a serious, potentially life-threatening eating disorder characterized by self-starvation and excessive weight loss. Many people with anorexia see themselves as overweight even though they are in fact underweight. Anorexia often begins following a major life change or stress-inducing event. Major depressive disorder is a mental disorder characterized by at least 2 weeks of low mood that is present across most situations. It is often accompanied by low self-esteem, loss of interest in normally enjoyable activities, low energy, and pain without a clear cause. People may also occasionally have false beliefs or see or hear things that others cannot. Social anxiety disorder, SAD, is an anxiety disorder characterized by a significant amount of fear in one or more social situations, causing considerable distress and impaired ability to function in at least some parts of daily life. These fears can be triggered by perceived or actual scrutiny from others. Thank you.